Hello, and welcome to Upfront. My name is Dean Thullner Veljasic, and we are filming on the unceded Nanaimo traditional territory. In 1985, a group of gay men sat down to take on the task, the endeavor to cope with the impending AIDS crisis that was now looming over Vancouver Island. They together formed an organization called AIDS Vancouver Island, which today is called AVI Health and Community Services. Today, my guest is Jeremy Mailloux, the Senior Manager of AVI. Hello, Jeremy.
Hi, Dean. Thanks for having me.
How are you today?
I am fantastic. I'm really grateful to be here with you.
Yeah, thanks for joining me. Jeremy, in 2011, the Center of Excellence at St. Paul's Hospital announced that there was a new drug therapy, HAART, highly active antiviral therapy. And they stated that if administered correctly and taken correctly, that all individuals who are living with HIV and or AIDS could expect to live their lifespan. Of course, that would change the trajectory, the programs, and the services that AVI would have had to offer at that time. So could you elaborate on how those changes took place, or what it looked like and how it has become what it is today?
Absolutely. We've come a long way since we were 5 men and 1 telephone line. It used to be just an information phone line, and they would pass it over to each other with call forwarding, which had just been invented at the time. And back in those days, I don't think that we ever thought we would get to where we are now. So antiretroviral therapy is now capable of stopping HIV from multiplying in your bloodstream, making you untransmittable and undetectable. So you can't give HIV to other people, and your lifespan is very, very close to what an average lifespan would have been pre-HIV. So what do we do now? We worked so hard as a community to come together to create this sort of organization that has a social justice theme to it, creates equity, and responds to community health crisis with integrity and advocacy. What do we do with that machine? Should we close up shop? Absolutely not. So along with the antiretroviral therapy, we also have gotten things like PrEP, which is a pre-exposure prophylaxis. It's a medication that you can give someone that will prevent them from acquiring HIV. So there's still lots of HIV out in the world, and one of our jobs now is to focus on PrEP, but that still wouldn't keep us all the way busy. As we grew as an organization, we took on these other things that we simply couldn't ignore because folks weren't doing them. So some of those things, and almost all of them, are social justice and based around health equity. But we've been able to take on a community health center model here in Nanaimo. And what's a community health center? It is a community-governed, social justice-oriented, primary care-focused clinic that provides a wraparound team and multidisciplinary care. Why are we the people to do that? We've already done all this work in the community to create something where the community has a big say and a big amount of autonomy in the services we provide. So going forward in Nanaimo, we are a community health center. We still have all of our great services that we've added on over the years, including some that we're going to talk about today. But we've gone far beyond hospital visitations and telephone information lines, and we've got more things coming in the future as well.
Well, we've certainly come a long way since the AIDS epidemic in the 80s. I remember being in Vancouver marching down streets with placards that said "ACT UP," and it was all about social justice, recognition, and representation all wrapped into one. We've certainly moved beyond that, thankfully. But we also have moved into a new world of crisis with mental health and addiction. And a lot of people say to me, mental health, is addiction mental health? Is mental health different than addiction? How do we define that?
You know, the word addiction is really so stigmatized in the world now, and it's perceived as a character flaw or something like that, something the person could individually be doing better. And that's simply not the case. There's no way to tease out, there's no way addiction is mental health. There's just no question about it. Addiction is almost always born of trauma, and that is why it is always going to be part of mental health. The treatments are all mental health treatments. It's very rare that we have a medication, although in some circumstances we do. But you can't just treat addiction by giving somebody a medication or a substitution or replacement. You have to treat the whole person. And that's what we're trying to do with the community health center model. Because it's a multidisciplinary team providing wraparound care, our goal is to treat the whole person, to make sure that all the determinants of health, the social determinants as well as the medical determinants, combine together to create good outcomes for people.
I think that's really what we're faced with, the struggle at this time, like finding enough resources to accommodate people who have had trauma in the interim of trying to get them physically and mentally well. Difficult.
This is absolutely true. Our healthcare system now is very much a stop here for this service, then go down the road to a different specialist. And it's at the convenience of the healthcare system, not at the convenience of the user necessarily. Our goal at AVI is to be able to provide all of these services in one place, including the mental health services. This shouldn't be something that we should send out or send you down the road to somebody else for.
Well, if you're watching the show today, go to avi.org. They have a tremendous amount of programs and outreach to help everyone in our community. Okay, so I've got some questions here I'd like to run by you, Jeremy, because they're questions that come to me on this show all the time, and I'm thinking you might be able to help us navigate. So the youth mental health crisis is a huge topic of conversation. How does AVI navigate through that?
Well, this is an emerging health crisis, which is something that's right in our bailiwick, right? So we date back to HIV, and we had to meet this emerging health crisis. So we have a little bit of organizational musculature around this. It's a number that you're seeing a lot right now. I think in some of the latest polls, up to 40% of youth indicate that they experience mental health issues, ranging from depression to anxiety, and all of that. And that's the first time in North American history that we've had this number of young people presenting with basic mental health issues. Some of this has to do with we have more awareness of it, but some of it has to do with sort of our society now. What we've done is we've siloed some service specifically for youth. So we have a counselor role. Our counselor is siloed very specifically around marginalized youth, so youth that are working around either severe mental health issues, they may be a member of the LGBTQ community, we do gender work with them, and we support them around any of the sort of marginalized pieces that they're personally experiencing. So the counselor is one big role. That has been very well uptook. We're full every single week in terms of available appointments. But we also have a new program starting in about a month from now, where we'll be having youth community meetings. So youth will come together, they will talk about the things that are important to them and tell us what their needs are. At AVI, because everything is generated by the community, that includes our goals and needs, right? So we're actually going to ask the youth, what are the things that are working and not working for you in your life right now? What can we do to support those pieces? And what can we collectively as a community do to improve the outcomes for these young people? We're going to have six different gatherings. And at each gathering, we'll have people speaking on things that are important to youth right now, whether that's talking about addiction or online bullying, or just the general lack of safe spaces for youth to go and speak to someone qualified.
So statistically, there's a disproportionate amount of LGBTQ2A+ individuals on the streets having to make decisions whether it's safer at home or on the street. But I think it's important for us to say today that AVI is not an LGBTQ clinic. This is a clinic that is low barrier, that is open to all youth.
Yeah. I'm glad you made that distinction, Dean. It's part of the growth that you asked me about earlier, right? Where Before, our service users came from one or two very specific communities. We've expanded our goal of health equity for everyone beyond the LGBTQ community, even though that's where the organization started. We've expanded that beyond to include anyone suffering marginalization or inequitable access to healthcare, whether you're an LGBTQ person, somebody who is using drugs and wants to change that behavior, anybody that doesn't feel comfortable accessing the sort of normal systems, because to be honest, there's a lot of barriers in that system. And somebody who's experienced a significant amount of trauma in their life might have difficulties accessing them in an equitable fashion.
All right. Yeah, well, I'm very happy to hear that your clinic is in a place recognizing trauma related to mental health. And I think a lot of people are quick to judge people on the street that do drugs or have addiction issues and are not really capable of seeing that that stems from a bigger issue. So that's incredible that you guys are there and that you're supporting our youth. Okay, second question. Can you tell me about AVI's trauma-informed approach and why it's important when serving marginalized populations?
Sure, you hear a lot about trauma-informed approaches these days, and what that means. And it can basically be boiled down to sort of two pieces. Number one, you meet people where they're at. So you meet them how they present, how they walk in the door, you speak to them in the language that they speak, you interact with them in the context that they're comfortable interacting with. We sort of have this idea, you walk into a doctor's office and you've got to do all these things before you get service. You have to sit in your chair properly. You have to show up, within 2 minutes or else your appointment's canceled. And a trauma-informed approach is about making sure none of those barriers exist whenever and at all possible. So meeting people sort of directly where they're at. And the other piece is remembering that your experience is not everyone's experience. Just because you can sit still for 2 minutes or you can be on time doesn't mean it's fair to have that expectation of everyone. It's giving them the most generous interpretation of what they're able to do for themselves and then walking next to them until they're able to do more or maybe not. So not having sort of goal-oriented care, letting the client have autonomy and make choices in their care and supporting them in those choices. Their choice may not be to stop doing drugs or to take that medication today, but we hope when we walk next to them for long enough that their choices can start to add up in a positive way, right? So, remembering that not everyone can be in a noisy room. I think you're seeing the world start to become a lot more trauma-informed. I think we are starting to care a lot more about each other. We all hear about things like trigger warnings, right? And people say, oh, what does that mean? And it's acknowledging that other people experience different sounds, sights, and contexts differently than you do, and not holding them to some standard that you've personally created or that the system has created. If the system worked, we would be in a different situation right now for healthcare across British Columbia. So that trauma-informed approach allows us to really meet marginalized people where they're at and provide a better quality service that leads to better outcomes.
Mm-hmm. But this is actually steeped in your mission. I mean, as far back as I can remember, when it was AIDS Vancouver Island and now AVI Health Centre, it's always been about compassion and kindness and really meeting people on their ground, right?
And that's because the community is making those decisions, right? So the community governance part, AVI has always had a strong hand. We were either created by the community or even now, our board of directors, for instance, has people from all walks of life that have different experiences that are very similar to the ones that we're supporting people in, right? So that's definitely a piece of that. I think back to the origins of the HIV movement, back when we used to just call it AIDS as an example. And I think about the pieces that we did to change language. So I think for a while we would say, no, that person doesn't have AIDS. We changed that to they have HIV, which was more accurate and less stigmatizing, right? We then changed that to people with HIV or people living with HIV, so PL HIVs, kind of a deal. And changing that from you're not your illness, you're a person with an illness, not an illness with a person, is really probably one of the first trauma-informed pieces that we saw come up through healthcare. And there's a lot of other sort of small touches like that that really started this trauma-informed movement that you're seeing in healthcare globally now. Much of that comes from the HIV movement, or was born of the ideas that we created 20 and 30 and 40 years ago. We didn't think that we'd need them so badly now. We thought we would have solved all these problems. We were pretty ambitious back in the day, right? I said, started at AVI and said I should have this HIV thing wrapped up by Thursday. And we still live in a world where 1 in 5 gay men are HIV positive, and we don't even have solid numbers for the rest of the community, other than knowing this is a preventable illness that still gets transmitted, and we still need to be doing this work in the way that we've always been doing it.
Well, absolutely. I was 20 in the 80s, and I buried most of my friends. And it was through AIDS Vancouver, actually, that a lot of my friends sought solace and had a lot of support. So I can just imagine the history of support and kindness and acceptance that you've been able to provide for our community.
Thanks. It actually harkens back, and we had some tricky moments over the years, right? I think back to, I came out in the 90s at 15 as a gay man. By the time I was 20, I knew too many dead men. And I did a lot of volunteer work, which is why I've come back to this, at this end of my career. And now we know too many, young people now know too many dead men and women as well from things like the overdose crisis.
Of course, it's very similar.
Yeah, we have
As gay men, we've been through 2 pandemics,
yes,
or maybe 3 because of the opioid crisis, right? But I see a lot of history repeating itself.
I'm hoping history can repeat itself in some positive ways too. One thing that I noticed is that, I started as an educator 4 years ago, and I realized pretty quick that, thinking back to my time as a young man working with an AIDS service organization, I had this great community around me. And there were people that helped me and made sure that I was able to survive what was a really dark time for our community. I look at youth now, and I look at the community now, we don't have those spaces anymore. We don't have those spaces to come together and make choices and decisions as a community. And that's sort of the part of history that we're trying to bring back at AVI, to give the community a voice and make sure we're doing the things that are important and valuable to the community, even if it's just to create some capacity or show folks how to be together in a space and support each other.
Great. All right. Third question. How can opportunities for social engagement create community and contribute to better mental health outcomes?
I don't want to give spoilers, but mental health is about to become an even larger focus for AVI at all of our sites, but very specifically in Nanaimo. And people like to think of mental health as what I mentioned earlier. Oh, we have a counselor. But mental health and self-care in general is a much broader topic. Social engagement opportunities, like some of the things we do, we have a men's hike every weekend, as an example. We have various groups that get together from different areas of lived experience. And sometimes they're doing a project like making badges that say a message that's important to them. What we learned over the years at AVI is, if you give folks a space to speak in, where they can have casual conversations, really incredible things happen. They find commonality, they find common space, and maybe they're there working on a collage or doing an art project that we started. And it's those conversations that happen in a non-clinical setting, where it's not you and a counselor, it's just you and another person that has walked the same path that you have. Great things can really come of that. We're increasingly isolated in the modern world. So I started noticing people would tell me, I don't have 5 friends. And I would say, what, you live in Vancouver, or you're a doctor. How do you not have 5 friends? We've lost some of those institutions in this world, whether they're legions, which I know we still have, but are not, as popular, or public libraries, or places we would go and meet together. Even things like bars or pubs,
It's all online.
Everything is online now, and we all get to feel like we have friends and we're socialized, but we might never meet that friend in person and be human beings with each other, just exist in a space, laugh together, cry together, pass information.
Or learn together. A lot of the mentors or the senior men in the gay community who passed away left a huge gap in our community because we didn't have people to learn from.
As a Gen X, so not quite senior, but as a Gen X person, I realized that we lost about 60% of that cohort of people that were there, that passed down great information to me. And I think our community also got fatigued by a 40-year pandemic. We all look back at COVID as being terrible, and it certainly was terrible, but HIV has been going on for 4 decades. There's still people acquiring it unnecessarily every day, and that almost always happens because of a lack of knowledge or a lack of deep connection to your community.
But to be clear, like from the early 80s until they discovered this cocktail in 2011, hundreds of thousands of gay men died in the prime of their lives. These were our fathers, our brothers, our neighbors, our friends, our co-workers. I remember thinking I'd go out to a bar on a Friday and ask where Mark was. Oh, he died on Thursday. I'd go out on Saturday. Well, where's Kevin? He died on Monday. It became almost so overwhelming that it became something I couldn't cope with anymore. But again, we lost so many men in our community that could educate us and to provide not only how to navigate being LGBTQ, but also the history that was behind it.
That same experience is actually happening right now to everybody. That is actually happening to everybody. The overdose crisis, the toxic drug poisonings that are happening in our community are absolutely recreating that terrible piece of history. We had almost 2,500 people die in Nanaimo last year. We have 2% of the province's population and 4% of the overdoses. Even 4 years ago when I started at AVI, we might see an overdose in the neighborhood or on the block. Things are getting so bad here that we're now seeing 5 or 6 overdoses a day. We used to have 1 or 2 clients. We hit a sweet spot. Because the medication got so good, our clients stopped dying. We would have 6, 7, even up to a year where we hadn't lost a client. And as the toxic drug crisis has ramped up, we're not having those 6, 7 months or a year. We're lucky to have 6 or 7 days now.
Well, the naloxone is not as effective now with some of the drugs that have evolved to be able to outbeat that.
And this is sort of a very good comparison of, before HIV, we always had STIs, but they weren't what HIV was, right? They didn't have the same serious consequences. You could compare the heroin use of yesterday to the fentanyl use of now. Most people don't know, but you can't actually buy heroin anywhere on the street right now. The only thing that's available is something 100 times more powerful than heroin. And it is not the same as it used to be. And so that parallel of this is a very rapidly increasing crisis, we're still lobbying and advocating and trying to get the government to do things and trying to get the general public, to not view this as supporting addicts or creating a worse problem than it was. People said that about us back in the day, that if we give these people medication, they'll just go and do whatever they want, right? And that's actually our goal at AVI is we would really love folks to be able to just go out into the world and do anything that they want and not have to worry about toxic drugs or viruses or things. That's kind of what we should all have.
All right, I have another question for you. How is AVI trying to incorporate Indigenous informed practice into their mental health support to create sustainable work environment and improve outcomes?
Yeah, that's a great question. And it really dovetails back to some of the other questions that you've been asking me about youth and about social engagement and pieces. AVI as an organization is broadly working around reconciliation at all of our sites and trying to decolonize a system that has been very hierarchical and colonial. And I don't mean AVI's system, I mean healthcare in general has been hierarchical and colonized and just exactly the opposite of trauma informed, right? It can be a very awful experience for folks, particularly if they're marginalized. As we have created good relationships with some of the amazing community partners that we work with, we've been able to really get a keen understanding that some of the Indigenous informed practices that we're learning from folks like Tillicum Lalum or Nanaimo, the Nanaimo folks, or FNHA as a whole, that's the First Nations Health Authority, when we look at the way that they're delivering medicine and services, it's better. It's better for people because it's based from community and from family and about treating each other like human beings, not like a revenue source or a number or an annoyance that's in line that's
or
stopping
a symptom.
me. Yes, or a symptom or an illness. Some of the work that's happening in Nanaimo right now, I'm almost ashamed that I didn't think of it first or wasn't doing it first, that we weren't addressing these things. Nanaimo First Nations has just announced within the last 48 hours that we have a foundry coming to Nanaimo. This is huge news. A foundry is a way to give healthcare and social support to Indigenous youth from an Indigenous informed fashion that's culturally appropriate and much more accessible than the systems that we have now for them. AVI has been a supporter as we've gone through the application process, and we hope to also be a supporter in terms of real medical care on the ground, because we've been able to sort of pick up some of these practices. Are we perfect? Absolutely not. Reconciliation is very uncomfortable, and it should be. We're taking apart hundreds and hundreds of years of empire and colonization, and it can be astoundingly difficult to do that. But every time I go and interface with my First Nations community partners, I bring something important back, or I understand that what has affected Indigenous folks is actually affecting us all, them first and hardest, and usually in a way that is deeper than other folks from different populations. But I was just at Comox First Nations this week, just on Monday of this week, for a wonderful workshop on colonization, where we learned sort of what things were like pre-colonization, and then the process of dismantling the family unit that happened and the community units that happened. And as I watched this, I thought, greater capitalism is doing this to all of us. And seeing my Indigenous partners teach me that things like ceremony and spiritual practices and family are actually the most important things for people really gives me realistic things that I can bring back to my office and change. We experience a lot of trauma in the work we do, a lot of vicarious trauma. I mentioned we will see folks overdose or be with them on very challenging days for them. And when I go to an FNHA event and somebody has an emotion, if a nurse cries, and I've seen this with my own eyes, a nurse have a moment in a meeting where she was overcome. In the rest of healthcare, we would tell that nurse, you go away, you go in the bathroom and you pull yourself together. When you're ready to come out here and be a worker, you get out here. And what do we get? We get burnt out nurses that aren't able to keep doing the job that they love. And that's a terrible situation to see a nurse in. At FNHA, we stopped the meeting, and I was very lucky to be a community partner at that meeting with community nurses. The meeting stopped. We brought out drums. We formed a circle. My good friend Connie Paul sang a song to breathe life back into this young woman's ear, this young, hardworking nurse who was overcome by some of what she's seeing in her community. And we stopped, and it was about healing that woman and providing her with support in that moment.
Well, I think that's what AVI tries to do on a daily basis. Listen, Jeremy, I'm so sorry to tell you that our time is up.
It can't be a half an hour.
It's already been a half an hour, so I'm going to have to get you to come back. Again, if you're watching the show today, please go to avi.org. They do incredible work. They have incredible programs, and they are there to help absolutely everyone in our community. Jeremy, on behalf of Rogers, behalf of myself, thank you and your team for all the good work you continue to do. Thanks for tuning in to Upfront. We look forward to seeing you next time.